Share. We've known about that for a while, and of course, I didn't mention the rest of New Start this morning, but after the T, temperance, the A stands for air, fresh air. And fresh air contains negatively charged ions that improve learning and concentration, reduce anxiety, improve mood. And those are produced by the moving ocean surf. This is why a lot of people like to live where they're close to the beach and that ocean water is producing those negative ions, where there's waterfalls or even moving streams after a thunderstorm as well. It's not good to be out in the thunderstorm, but as soon as it's over with, it's great to be out there and breathe that fresh air in. Evergreen trees also emit negative ions, one of the advantages of Weimar with its many evergreens there. But there are some additional benefits beyond just the fresh air in what's called green spaces. We have found by looking at, this was an original study from Denmark where it's a totally government-run healthcare with all the diagnoses, so they can tell the diagnoses and the disease rates just by satellite, and they noticed a big association between disease and lack of green spaces. Growing up near green spaces is associated with a 15 to 55% decreased risk of developing psychiatric illness in adulthood, depending on the specific illness. And the green space effect is dose dependent, meaning the more we're around green spaces, and of course this isn't just painting them green, this is actually living green, enhances emotional intelligence, and spending at least 120 minutes a week in nature is associated with better health and well-being. So that's not a lot of time, but a couple hours is more than what most people spend, unfortunately. Adolescents who spend time in green space have reduced stress, better emotional well-being, less depression, and improved mental health. And now we're talking about NBIs in the scientific literature, nature-based interventions. Just being out in nature and taking a hike in nature can improve depression and anxiety, improve stress control, reduce negative ruminations, and improve focus, also improve sleep. And the more you're out in nature, the more you want to exercise as well, so it induces more physical exercise. And I don't know if you've noticed, but when you're out there in the sun, it's really hard to even read your phone or screens. And so when you're out there in nature, reduced use of technology, which also has significant advantages. A meta-analysis was published recently on the health effects of gardening and horticulture and found these positive effects. Reduces depression and anxiety, reduces body mass index, increases life satisfaction, increases quality of life, as well as self-esteem and self-worth. But the mental effects continue to go on. And some of those mental effects, the Japanese have determined, are due to forest bathing. So forest bathing just means that you're spending time in nature in forests where there are trees and leaves. And researchers found that walking for 2 hours in a mixed natural forest environment improved tension and anxiety, depression and dejection, anger and hostility, as well as fatigue, less confusion as well. Additionally, forest bathing changed those with negative mood states overall to positive ones just by being out and walking in a forest. And of course, the question is, what is this? Why are the forests so healthy? And of course, they do have fresh air, they do have light, but there's something that is emitted by the trees themselves that have a benefit. This is where the entire essential oil business has come from. And this is the oils that are being emitted from the trees can have some significant positive effects. It can even increase serotonin levels just being out there in the forest. So additional benefits are lowered blood pressure in those with hypertension, improved autonomic function, so the sympathetic and parasympathetic nervous system also can work better. Immune system is also enhanced, less respiratory allergies when we're out in nature, particularly growing up, and improved mood and stress, and it also improves even attention deficit hyperactivity disorder. In the immune system, it actually was shown to increase natural killer cells and monocytes. That's your native immunity, and how well you did with COVID was based on a large degree on your native immunity, those monocytes. And being outside helps in a number of ways. This is one of the reasons why, I don't know if you remember, but during the pandemic, when Italy was being wiped out, and of course China had issues, America had issues, people said, just wait till it goes to Africa. It could essentially wipe out the continent of Africa because they don't have ventilators, they don't have ICUs, they don't have hospitals. And Africa was barely affected. Why was Africa not affected? With no good healthcare system? Most of those Africans spend a lot of time outdoors. And the outdoors actually help their native immunity. And there's something else that also helped that we'll talk about here in a little bit. Also, when you're out there in the forest, improved sense of awe, gratitude, and selflessness. So that's one of the advantages of also being at Weimar and our depression and anxiety recovery program and our New Start program. We have 15 miles of trails all on the Weimar campus. And those trails were used a lot during the pandemic. When the pandemic occurred, we tried to hike Stevens Trail, which would be a national park if it were anywhere else in any other state. But California already has 9 national parks, so they're not going to give us any more. It's just a few miles from Weimar, these drop-dead gorgeous hikes, and they were all blocked off. No, trails closed, do not come, COVID pandemic. And Yosemite was closed, and all of these national parks closed down during the COVID pandemic. And it was almost like if you get on a trail, you might get COVID, so stay off that trail. But Weimar, actually, we kept our trails open to the public, and so a lot of the public started to learn our trails. We're already being written up now in trail magazines and hiking magazines from people going through there. But just hiking those Weimar trails can give you an improved sense of awe, gratitude, and selflessness. So what are the essential oils that have been shown to benefit depression and anxiety that are emitted from plants? These that I'm mentioning to you are all randomized controlled trials, but one of them is Selexon. Selexon is an oil that is emitted from the lavender plant, and it's actually been shown to reduce not only depression, but anxiety. In fact, 80 milligrams of Selexon, if you were to take it orally, is equivalent to a 1/4 milligram of lorazepam. Lorazepam is a benzo that is used extensively to help anxiety, but it has a side effect of suppressing your frontal lobe and hooking you by getting rid of your GABA manufacturing plant in your brain. But Selexon does not do that. No frontal lobe suppression. For instance, there are people that have test anxiety. They learn their material well, they go in and take a test, and they can't think and reason because of their anxiety. So sometimes lorazepam is given, and if lorazepam is given, they feel better about their test, but they do even worse on the test because it suppresses their frontal lobe. But when they take Selexon, they feel better and they do better on the test because no frontal lobe suppression. So often these essential oils will work better than standard traditional medications. Bergamot is another oil from citrus in Central America that's shown to have antidepressant effects. Sandalwood also produces an odor and an oil that from the wood itself that actually has an antidepressant effect. Mint also has a significant antidepressant effect, as well as sweet almond. In our massages we do, people that come to our program also get massage, which has been shown to be helpful for depression and anxiety. And if we use that sweet almond oil massage, they'll get a double benefit because they're also inhaling that antidepressant effect of the sweet almond. Anxiety, well, wait a minute, one other thing, pine needle extract. So when you're out there in the evergreen trees, it's not only the negative ions that's helping you, it's actually the oil of breathing in the pine needle extract. This is why we recommend in America, where it's very common for people to have Christmas trees, to spend the extra money and get the actual Christmas tree, because you will get that odor of that pine needle extract. It actually has an antidepressant effect when you come home and breathe that pine needle extract that's been freshly cut. We live up in the mountains by Weimar, and we've never had to buy a Christmas tree. Erica just goes out there with a little chainsaw, and we bring a Christmas tree freshly cut right from our yard that comes in with all the evergreens that are out there, and that smell is nice. Anxiety, Selexon, yuzu, limonene, linalool acetate, these are all been shown in randomized controlled trials to be very helpful with anxiety. Regarding Selexon, it actually has been shown to increase serotonin release and extracellular brain serotonin levels. That's how it's working as far as the depression. Smelling it helps, but it's most effective and predictable when taken orally. Also, there are significant benefits of deep breathing. Deep breathing, just taking several deep breaths in and out, have shown to be beneficial in relaxing the body. You increase your oxygen levels, your oxygen saturation will go up. It helps prevent respiratory infections. A lot of respiratory infections come about from shallow breathing, induces a sound, sweet sleep, and also improves mood. There was an interesting trial that I wouldn't have thought necessarily would have produced a statistically significant benefit. Sometimes some very simple things can produce a profound effect. But this is where we train people to do proper diaphragmatic breathing, focusing on slow, deep breaths that rely on the diaphragm. And of course, that can get rid of one of the associations of anxiety, which are the rapid, shallow breaths. Maintaining good posture also helps you with the deep breathing. And so this study was a controlled trial for 8 weeks. What did they do? Breathing exercises where they were breathing deeply so that they did not breathe more than 4 breaths per minute. So the only way you can breathe 1 breath every 15 seconds and not get short of breath is to breathe out. Breathe deeply. So how long did they do this for? 15 minutes. So that means you would take 60 breaths in 15 minutes and just do that on Monday, Wednesday, and Friday, 3 days a week. Then they followed them in a randomized controlled trial for 8 weeks. What they found is a significant improvement in mood, anxiety, focus, attention, and even cortisol levels in just 8 weeks. That's significant. And, if you look up deep breathing in Ellen White's writings, it's pretty amazing. She talks about these very things. And, of course, someone was wise enough to do a randomized controlled trial on it. So, not hard to do. Only takes 45 minutes for an entire week to do this. But it not only helped, of course, while you're going through the exercise, but it its extension of the benefits lasted throughout. And of course, that doesn't cost anything. Of course, cold water bath, known as cryotherapy, has been shown to be very helpful as well. And this is something, a little bit of background on this. When we first started doing depression and anxiety recovery programs, it was in Oklahoma at the Lifestyle Center of America. And I was actually asked, since we were running an outpatient program and my practice was very much involved in mental health at that point. And of course, my receptionist was saying, we can't see every depressed person in this town because we were getting backed up in schedules with all of the mental health cases because just by word of mouth, see Dr. Nedley and he'll find out what's wrong and you'll get rid of your depression and anxiety. So that's how I decided to write the book, Depression: The Way Out. And then also I realized a lot of people are so depressed they can't focus enough to even read. So then we came out with the community program, which had videos and a workbook. And then after that, the Lifestyle Center of America said, we're not able to fill our diabetes program and our other programs. Why don't you do a residential program for depression? And I told them I will, based on one condition, because they were going to be taking the calls and signing them up and things. And I said, tell them that 18 days is too short. And although they can come for a residential program, they will not get any better in 18 days. It takes at least a month for depression and anxiety to start to clear. And so I said, if you tell them that, then I'll do the program. So they told them all that, and we had 29 people sign up for that first program, 28 females and only one male. The males weren't willing to come if it was, they're not going to get better by the time they left, but the females were looking at it more for the long term, I guess, and so they signed up. And by the way, that male still calls me from time to time. He's still doing very well since that program. And the females did very well as well. And the second program we ran, we were in the first and second program. We started noticing people getting better, after 10 days, 12, 14 days, they'd be getting better. And it was happening a whole lot quicker than I thought. And of course, if you use all of these things together, you have a synergistic effect. So it can have a real positive effect. But by day 14 of this 18-day program, there was one woman who wasn't doing any better. And she was getting scared because, when you start seeing everyone else get better and you're not getting better, she started to get worried. And so at that point, we decided to do the contrast hydrotherapy. After 2 days of that, she was better than the other ones who had already started to get better. And they're all saying, we want what she's getting. How come she's only the one getting that? And so that's when we decided on the next program, we ought to have everyone, as long as it's not a contraindication, to do the contrast hydrotherapy. And then when we found out we did it with everybody, they started to get better in a week, 8, 9 days, significant better. And so that's why we shortened it to 10 days. So about 20% of our patients will need more than the 10 days. And so we allow them to have the full 17, 18 days if they need it. We had 21 go through the program I just told you last time, and 4 are staying there. They're still there. The program just ended on Monday. But I saw them yesterday before I came down, and they're doing much better. And they're going to be able to go home. But these stimulated contrast baths are indeed helpful. In fact, they're so helpful that even a serious mental health condition, we've treated schizophrenia before, and that improves with lifestyle approaches. But even severe schizophrenia, we've seen it normalize after the cold bath. And it will take longer for them. The schizophrenics like the cold bath. They'll stay there as long as you let them. And when they get out, we'll give them a phone and they'll talk to their relatives. And their relatives will say, I haven't had a conversation with my son like this in 20 years. You know, it's just amazing. His mind is there. It's back, but it's temporary. So, you know, after about 15 or 30 minutes, it starts to revert back into its schizophrenic form. And, of course, you can't live your whole life in a cold tank. But there are some things going on there that certainly also help depression and anxiety. So a series of short, repeated immersions in water alternating between hot and cold temperatures. As you know, it's being used extensively in sports medicine, athletic training, rehab settings as well. And so many people are referred, when they have severe depression, to ECT, electroconvulsive therapy. We call hydrotherapy natural shock therapy because it does kind of shock the system when you get into the cold. Now, we are compassionate, so after they're in 104 degrees and getting nice and warm, that first cold bath is only about 60 degrees, so it's actually warmer than the Pacific Ocean. But then we start cranking it down. As they start to tolerate that, we're able to crank it down. And by the way, these ones that stayed extra, they were all telling me on Friday, we're down to 45 degrees now, and we're getting that effect. We're very much enjoying that. So it increases blood flow and oxygenation to the tissue and brains, decreases swelling and stiffness. Many people with chronic pain, their pain will go away with the hydrotherapy. We've seen that so many times where chronic pain patients are doing so much better. Promotes healing, improves limb function, quickens recovery. One of the participants we went through was an Air Force pilot who had collapsed his vertebrae just by a helicopter accident. So he had, helicopters, for those that are in aviation, different than a gyrocopter. A gyrocopter always stays out of the dead zone. So gyrocopters are much safer than helicopters, but helicopters live a lot of their life in the dead zone. And the dead zone means that if you lose power at a certain elevation, there's not enough for you to be able to, when you're hovering, to be able to build up enough airspeed to be able to land it safely. And so that dead zone is less than 500 feet. So he had lost power when he was like 400 feet off, something like that. But when he crashed, his entire spinal cord collapsed and just severe pain, had multiple surgeries. It was just a terrible ordeal for him. And his life just changed significantly. Of course, got depression and all of those things. And he came to our program, and with hydro, his chronic spinal pain went away. Even with all those rods and everything there. In fact, he wanted to stay another week just to benefit. He didn't need to stay. His depression and anxiety were better in 10 days. But he wanted to stay just for the effects on his spine, and we still keep in touch with him as well. And he's one of those that bought the cold plunge for him to use at home. So hydrotherapy does improve depression as well, and we have yet to have a patient that was referred. Many patients don't end up coming to us until things get extreme. So when they are referred to ECT, sometimes they'll start looking at, well, can I do something else besides inducing seizures that are going to adversely affect my memory for life? And so then they'll find us. But we have yet to have a patient that was referred for ECT that ended up needing ECT if they came to our program. One of the other simple things that helps out is light therapy. Light therapy, we know, treats seasonal affective disorder. This is more winter depression. But even for our standard non-seasonal depression, it gives results quicker than SSRIs. And it works best for those who also have fatigue associated with the depression, or they have a tendency to eat or sleep too much. They're eating too much because they're self-medicating for their depression, and they're also wanting to sleep all the time. It's also very effective for postpartum and postpartum depression, and it's highly effective for bipolar depression. The bipolar phase of depression will significantly improve with light therapy, and it will improve it more quickly than medication does. But of course, it can be used with or without medicine. A lot of people say, oh, I can't use light therapy, I'm on medicine. No, not true. It can be an additional benefit. So you need 2,500 lux of light for 2 hours in the morning, or if you brighten it to 5,000 lux for 1 hour in the morning, or 10,000 lux for 30 minutes in the morning. And this is what we used to do when we started our program 20 plus years ago. It was all white light therapy. And white light is full spectrum. And we didn't realize then, and the researchers didn't realize, that the white helps, but it's actually the blue portion that's helping. So we were able to just use the blue, which is 450 to 400 nanometer wavelength, for just 1,000 lux, or even down to 100 lux. We have glasses now that you can wear that emit this 100 lux, and it's actually equivalent to a 10,000 lux white light. So that's a lot safer for the eyes, a lot easier to tolerate. And this is the same wavelength of the blue sky if you were to go out there in the morning. And so this can start benefiting depression. You want it offset. It's not the direct light that's helpful. It's through the rods of the eyes. If you remember, the cones are your direct vision. Rods are your peripheral vision. And the rods are the ones that are hooked up to the serotonin manufacturing plant and also to the suprachiasmatic nucleus in the brain, which is what sets the circadian rhythm. This was also an interesting study. Researchers found that men who are exposed to an hour of bright light first thing in the morning experienced an increase in a pituitary hormone, which sits at the bottom of your brain, called luteinizing hormone. Just one moment, I'm going to pause on this. This is my pilot coming to pick me up, and he's going to tell me about the weather. Hello. All right. Very good. I started late, so I'll be probably there about a half hour late. All right, great, thanks. Bye. The weather is good enough. He's coming to pick me up. So researchers found that men who were exposed to an hour of bright light had this luteinizing hormone spike. Luteinizing hormone influences reproductive hormones in both men and women. Increases in LH in men drive up testosterone levels, while the hormone triggers ovulation in women. Now, I don't know if you realize, but there's a racket going on in America in regards to men knowing their T levels. Know what your testosterone levels are. And testosterone levels, of course, vary throughout the day, and they tend to peak more in the morning. But testosterone, of course, is very healthy for males to get enough of it. You don't want too much. Too much will increase anxiety. Too much will turn you into a fighter in your home. And it may get rid of any female wanting to have your testosterone on display. And so it can adversely affect relationships and all sorts of things. But we want to have enough of it, because if you don't have enough, you don't have as high an IQ, you don't have that persistence, and the drive and the motivation can go down, and also your fat levels can increase and your muscles can go down. And so if people are having low T, then you can, as a physician, you can make a lot of money by installing these testosterone pellets or all sorts of different therapeutic techniques. Of course, they're not told that if you get this, you're going to shrink your testicles down, and you're going to get testicular atrophy, and then you're going to be dependent on it for a long period of time, etc. But there are simple things that can raise the testosterone. And one of those is just an hour of light therapy every morning. This is why in yesterday's agricultural society, you didn't have all these testosterone issues. The farmers were out there in the morning, they were getting that bright light, and in our studies that we did in our clinic, testosterone levels will double in about 4 to 6 weeks after using bright light therapy. And that means that you don't have to be on those types of things. Now, they also won't tell you that if you quit overdoing it sexually, it will also spike. So it takes 7 days after the last sexual activity before the testosterone spikes. And if you wait even longer, it'll spike even more. And so a lot of individuals are overdoing it on that side of things, adversely affecting it. And they're also on their phones in the morning, but not outside, or they're not getting the bright light. And so that can have an effect. Now notice it also triggers ovulation in women. So this is one of the therapies for particularly a disease that's pretty common in women called polycystic ovaries. About 20% of women can have polycystic ovaries where they have irregular periods and all of this, and the light therapy can help them. Studies shown it helps with depression. It also improves libido and have a muscle building and strengthening effect. A lot of these medications that men are advertised to help their ED, those meds do not help testosterone levels. They don't help libido. They're just working on the end organ, and people don't realize that if we just do something like this that's simple, you wouldn't need to have those drugs, and everything would work fine. When women with long and irregular menstrual cycles exposed to bright light, the cycles regularize. So it has some significant advantages, but the average American spends over 90% of their time indoors. That was a study in 2019 prior to COVID. It was actually 91% of Americans spend their time indoors. Do you think that got better or worse with COVID? It got worse. People were told not even to go hiking, don't get outside, stay inside, and just be on screens all day long. And people were taken out of the school system and just put on screens. By the way, our college professors are now admitting these students that went to high school under COVID. They're finding out very little learning occurred. They're having to teach them 9th grade English, 10th grade English. It's pretty sad that Zoom was not the learning environment that everyone thought it might be. And of course, there's a reason for that. In fact, we probably should talk a little bit about that reason. The way devices are used today, they actually shrink the frontal lobe of the brain. They shrink your ability to learn, retain, and apply knowledge. Why is that the case? Studies show that when you tell some student, college or high school, to get online, to do some research, to do their homework, they will get online, start doing the research, but within 3 minutes, they're no longer doing their homework. Why aren't they doing their homework? They got distracted. And what happens is, when you get on to do your homework, the engineers know this kid is interested in BMWs. So within 3 minutes, there's a little BMW car floating across the screen that says, there's a new A30, it's your local BMW dealer. Oh, I heard that was coming out. Oh, well, it won't take me too long to figure out what's going on here and see what's there. Let me learn about this car. So they click on the car. And as they're reading about the car, then a push notification comes in saying, Donald Trump just got handcuffed and put in a New York City jail. oh, I've got to see that. And so they're looking at the pictures of him getting handcuffed and the look on his face. And then you can see what the woke left says about it. And then you can see what the right says about it. And as they're going through that, then a friend of theirs realizes they're online and sends them a Snapchat. If you don't look at that Snapchat picture, you're not going to see it. And so, well, my friend is on here. What's my friend sending me a picture of? Well, then I'm going to look at this. And pretty soon, with all of these distractions, 30 plus minutes have passed. And then the student is trying to figure out, why did I get online to begin with? Oh yeah, it's my homework. Now, studies have shown that the anterior cingulate gyrus, which is the frontal lobe area that you use to manage distressing emotions, that area of the brain is the one that shrinks down when you never focus or pay attention for more than a few minutes. And so when people were on Zoom and they were trying to learn from their teachers, they weren't listening to their teachers for very long. Yeah, they had them in a small box of an audio down there, but they were getting continually distracted, and their brains shrank down in the anterior cingulate gyrus. And that's why they couldn't manage distressing emotions. And this is why skyrocketing, every country in the world, once that country, 50% of the people own a smartphone in that country, rates of depression, anxiety, and suicide explode. And so we have to use our devices differently if we're going to use them. And of course, there are some convenience things. You know, I've never heard anyone get stuck in their GPS. You know, so you might use it for a GPS to get to a new location. That's fine. But getting on YouTube is dangerous because you go a 1 minute short, and then pretty soon there's 15 other 1 minute shorts, and you're not doing anything to really have focused attention. And even if you like it, if an engineer comes out, say it's that kid that likes BMW. The BMW engineer is going to talk about a particular aspect of engineering, and the length of the talk is 75 minutes. That kid says, I like BMWs, but there's no way I'm listening to an engineer for 75 minutes because I'm not going to be able to focus. I don't have the ability to even follow that logical succession of what that engineer is going to go into. And so they reject that aspect of things. And so there were some serious learning problems occurring when COVID hit and everyone got put on Zoom. But one of the advantages of being outdoors is infrared light. Now, we know vitamin D is helpful. Vitamin D you don't get from infrared, you get from ultraviolet. And the ultraviolet is only available when it's direct sun. Sunset, sunrise, no vitamin D. In fact, how do you know if you're making vitamin D out in the sun? You look at your shadow, and if your shadow is longer than you are, say it's twice as long, and it ends where those steps are at over there, no vitamin D is being made by your skin. It has to be the same length or shorter than you are. But it's different in regards to infrared. We get infrared from sunup to sundown, and it's a much longer wavelength. In fact, we can't see infrared, nor can we see ultraviolet, but ultraviolet is short wavelength, infrared is long wavelength. And the near-infrared portion of natural sunlight has been shown to stimulate an excess of antioxidants in each of our healthy cells. The cumulative effect of this antioxidant reservoir enhances the body's ability to rapidly deal with changing conditions throughout the day. We have known that melatonin, which we secrete at night, this is what helps you to have rest and rejuvenation at night. Melatonin, under periods of darkness, is made by the brain and then circulated throughout the bloodstream. Melatonin is the most potent antioxidant known to mankind, 30 times more potent than vitamin E. But intracellular melatonin is made in response to infrared light. And that intracellular melatonin protects your mitochondria from breaking down and has been shown to have a number of positive effects without any negative effects. Too much ultraviolet light, you'll get a sunburn and maybe melanoma or skin cancer. Too much infrared light doesn't have any adverse effects. Near-infrared light falls in the spectrum of 700 nanometers to 2,500 nanometers, and it boosts metabolism. It prevents your mitochondria, particularly in your brain, from burning out. Infrared light penetrates your skull, and the gray matter of your brain is the periphery of your brain. The reason why it's gray matter is because that's where all the mitochondria is at. Your biggest energy-producing cells in your body are in your brain. And the brain expends a lot of energy, also makes a lot of energy, and the gray matter is gray because of the density of mitochondria. So when there's a lot of mitochondria in that cell, it's gray. And the infrared, if you're out in sunlight, infrared will actually prevent that, those mitochondria from burning out. This is one of the reasons why Dr. John Scharfenberg, he spoke at our EQ Summit in March. He's over 100 years old, and his mind is as sharp as can be. He remembers everything. He actually still walks on his own power. He drives. He actually travels internationally all by himself. He's an amazing 100-year-old man, but he said he intentionally spent a lot of time outdoors because of that natural remedy called sunlight. And so he was working outdoors even a significant amount of hours from his early 50s on. And he said, my other family members, they ate healthy, similar to what I did, but they were not outdoors. And they all died and had issues in their 80s. And he said, with me, I was outdoors. And that was one thing. The other thing that he said really helped him, we'll get to the end of this, is daily ketosis. Ketosis means that you're not eating suppers in the evening. And ketosis is very protective of the brain itself, so called intermittent fasting. But back to near-infrared. It increases your energy. Cognitive performance enhancement has also been shown to occur. In fact, if you've had head injury, you need infrared after that head injury to help you heal from it. Reduces PTSD symptoms and reduces inflammation within the body, and it also is a potent pain reliever. We have an individual, one of those 4 that stayed in our program. He has significant chronic pain, and the 2 things, the hydrotherapy and the infrared, he says, has gotten rid of his pain. No reason for even Tylenol anymore. So this is something you can actually get an infrared emitting device, LED. You want to get the near-infrared device, and it can have an effect. I had, I'll tell you kind of a dramatic story, but this was a Canadian girl up from very northern aspects of Alberta. 8-year-old girl, and she was having seizures from age 6. Or maybe it was 7. But anyways, yeah, I saw her, I think, a year and a half into her seizures. I say I saw her. It was by Zoom. And her parents were concerned because her neurologist put her on benzos for her seizure. Benzodiazepines are like alcohol in a pill and suppressing the frontal lobe of the brain. And they also hook you. And they asked, can we have something else for her seizures that are not going to be this? And he says, no, not unless this works, but you have to try it out. And if it's not tried out, then the parents are turned in to, DHS, or the equivalent to the Canadian DHS, and you lose your kid. So they were hoping for an alternative for this. And so when I was talking to them and doing the Zoom workup, I realized that this kid spent a lot of time outdoors in the summer, and she didn't have seizures in the summer. It was only when fall hit. Fall and winter and a little bit of spring. And then she'd get outdoors again with those long Alberta days, and the seizures would go away. So when I heard about that and heard about other things, I said, get a near-infrared emitting device. And so they exposed that to her. It It was late in the summer. They exposed it to her twice a day, 15 minutes, where she would actually just emit this thing on the top of her brain in front of her. And 15 minutes twice a day. She would do it front and back and the top, and never had a seizure all the way through. And so that's the potent effect that this infrared can have in helping to stabilize the brain. So I'm going to skip through a little bit of this and go to this. And that is the synapse. So if you notice here at the top, I don't know if you can see yeah, you can see it. L-tyrosine. L-tyrosine is an amino acid that we have to get into our brain to make dopamine and norepinephrine. Now, those are two very important neurotransmitters, and I still work in ICU 3 days a month consecutively just to keep my ICU skills up. And a lot of those ICU nurses know I'm dealing with depression and anxiety all the time. And so one of the questions they've asked me is, Dr. Nedley, how come when we put people on a dopamine drip, it doesn't help their depression? You know, we have these drugs that are supposed to help dopamine, and we're giving them straight dopamine, and it doesn't help their depression at all. Well, pretty easy answer, because dopamine does not cross the blood-brain barrier. Neither does norepinephrine. Neither does serotonin. 95% of your serotonin is made in your gut. It's not helping your brain at all. So we need the nutrients to go into the brain and have the brain make its own dopamine, its own serotonin. And this is critically important to be able to treat the biochemical aspects of depression, which just about everybody has some biochemical issues. So you see when L-tyrosine then goes into DOPA and then goes into dopamine, and then if there's enough free copper around, it will go into norepinephrine. If there's too much free copper, it'll go exclusively to norepinephrine and away from dopamine. You can get too much norepinephrine and not enough dopamine that way, which can produce a lot of anxiety and a lot of decrease in motivation. Now, the pharmaceutical companies come along, and they have not been able to find anything that helps you make dopamine better or serotonin better. They haven't found anything that helps you build up receptors to increase the synapse. And so how is it that the doctor says, we're going to put you on this to increase your norepinephrine synapse? Well, the drug does that. It does increase the norepinephrine synapse by plugging off these side channels. See these channels here? These are the reuptake channels. After norepinephrine does its job, it's then vacuumed back up into the cell for further usage. Why is that the case? Because it takes 1 billion ATP to make one of those norepinephrine molecules. And the body doesn't want to have to go through all that energy again. It wants to be able to reuse it. But if we don't have enough norepinephrine, as we plug those channels, it's not vacuumed back up, and now it can sit around in the synapse longer and bind onto that receptor. And so it does help short term, but long term, it's going to deplete the neuron of the very substance that was already depleted as to the reason why you needed it. So this is why 6 and 9 months later or a year later, they're needing higher doses. They continue to have to see psychiatric clinics or their family primary care clinic to get their doses adjusted and more medicine. And so they get on this, what we call psychiatric cripple pathway. But no one has actually tried to figure out, why was this person not making enough norepinephrine to begin with? Maybe they weren't getting enough tyrosine. Maybe they weren't getting enough of the B vitamins to be able to make it. Maybe they weren't eating tyrosine with carbohydrates. Maybe they were only getting tyrosine in regards to meat. And so nutritional issues can produce biochemical issues in the brain. Insufficient dietary tryptophan can be a major issue. Tryptophan is the least abundant amino acid in the diet, and that's what we need to make serotonin. Insufficient dietary tyrosine, or particularly brain tryptophan and tyrosine. Too much cholesterol. Our neurotransmitters have issues when there's too much cholesterol on board. And it's been shown to be very much associated with treatment-resistant depression. So they won't even respond to medicine so well when their cholesterol is high. Too much arachidonic acid causes inflammation in the brain. Depression and anxiety is often an inflammatory disease of the brain. Not enough folate. Folate is a B vitamin that we need to make 3 different neurotransmitters. Not enough iron. Iron is involved in making 4 different neurotransmitters, including the calming one called GABA-aminobutyric acid. Low omega-3 fatty acid intake can also be an issue. That's an essential fat, and many people are not getting enough in their diet. Insufficient magnesium can prevent us from methylating to make the final step. And insufficient zinc can help us or prevent us from getting enough receptors there in the brain. And then, of course, there can be other B vitamins involved. And so when people come to our program, this is their last stop, and so we don't leave any stone unturned, and we're going to find out what their brain biochemistry is like so we can precisely give them what they lack or take away what they have too much of. And wow, how much the brain gets better. Tryptophan, for instance, when it's given with carbs and the B vitamins, will decrease quarrelsome behaviors, improve your mood, and increase agreeable behaviors. You might want to give your family members tryptophan if you're having problems getting along with them, or maybe you need to take it. Premenstrual dysphoria is also improved. Seasonal affective disorder is improved. Depression, insomnia. Why insomnia? Tryptophan is not only needed to make serotonin, it's also under nighttime conditions then turned into melatonin. It improves obstructive sleep apnea. It actually has been shown to improve drug withdrawal. This is why people that have addictions do very well in our program, because we're correcting the brain chemistry aspects and also significantly helping with the withdrawal symptoms. Just an example of this, we had a man come to us who had started to get some significant memory issues because he had been on Xanax for 20 years. Not just a half a milligram at night, he was taking 2 milligrams 3 times a day. That's a huge amount of Xanax. And it's a frontal lobe suppressant. And his parents lived into their 90s, and they had sharp minds. And he had been a professional and had a wonderful cognitive background. But then he had a heart attack. And after his heart attack, he started to get into PVCs. And his primary care doctor thought, well, I think anxiety is producing your PVCs. Well, he was having anxiety over his PVCs. So because he had anxiety over his PVCs, the doctor says, get on Xanax. So Xanax helped his anxiety, but now he's running into all of the side effects and complications of it. 2 milligrams 3 times a day. We told him to try to wean it down before he came. He said he couldn't even wean it down 1/4 milligram. Significant issues. He can't wean it down. He can't function without it. So he came to our program, and we put him on the things that would help him out, including these things to help him make more serotonin, etc. And we switched him over to a long-acting benzo where it's easier to withdraw from. And he was off. His last benzo was taken 8 days into the program. And he was amazed. Wow, I'm functioning. I don't have anxiety. I'm doing well. And I just didn't know it would be that easy. Now, what we have to tell these people is, don't think because it was that easy to pick it back up again. Because it won't be easy at home. We're using the hydrotherapy. We're using all of these things that are going to help his brain. And you can't necessarily be on that type of program with that type of intensity at home. So you have to be benzo-free from here on out. But it helps even benzos, nicotine withdrawal. We have people that undergo nicotine withdrawal all the time in our program, and they have a hard time stopping their vaping and all of that at home. But when they come to our program, they're surprised at how easy it is. Tryptophan will also help with autism and cognitive function as well, and social affiliation, and we mentioned sleep earlier. Well, these are the foods that are high in tryptophan. Oats, this is density per 100 grams. Oats are up there. Tofu is higher yet. Flaxseed, by the way, we give people a tablespoon of flaxseed 3 times a day in our program because of its not only tryptophan content, but tyrosine and also omega-3. Black walnuts are more, sunflower seeds even more, sesame seeds even more. Chia seeds are near the top when it comes to tryptophan and serotonin, and the highest are actually pumpkin and squash seeds. We utilize something called zoo butter in our program, which has pumpkin, chia, flax, and it's kind of like peanut butter, except it tastes better, I think. And it is a butter that's going to really help get the nutrients into the brain that's needed. Now, there are those competitors as well. The competitors are, this is one of the reasons why exercise works. In fact, I haven't talked about exercise, but that's also a very simple remedy. And it takes endurance. As we build up our fitness, we build up more receptors in the brain, but we're also able to make more serotonin. And the reason for that is when we exercise, we are picking up the large neutral amino acids into our muscles that compete with tryptophan getting across the blood-brain barrier. By the way, tryptophan doesn't cross either. It has to have a specific carrier, and that carrier carries 6 different amino acids over. And the large neutral amino acids that are more present in meat actually prevent the tryptophan from turkey getting across. This is why meat is not the best food. Meat has tryptophan, turkey has tryptophan, but that tryptophan does not cross the blood-brain barrier because of the competition in turkey. And so we have to have it with carbs and the right B vitamins. But as we exercise, those large neutral amino acids are picked up by our muscles, and we get much more tryptophan uptake to be able to supply the manufacturing plant in our brain that makes serotonin. So tryptophan, carbs, and mental health. 3 critical dietary factors work together to improve mood, and that is tryptophan, carbs, and water-soluble vitamins and minerals. And that includes vitamin B12 as well as B6. So as this study shows, large neutral amino acids compete with tryptophan to cross the blood-brain barrier. Carbs derived from whole foods tend to reduce the stress hormone cortisol. Carbs induce muscles to uptake large neutral amino acids as well. So it's carbs and the exercise, thus improving tryptophan access to the brain. Carbs increase brain tryptophan absorption and therefore increase serotonin. And a low-carb, high-protein diet actually reduces the amount of tryptophan that's taken up in the brain. This is why a strict keto diet is not sustainable for mental health. And as Simon Young printed in the Journal of Psychiatric Neuroscience, tryptophan is transported into the brain by a transport system that is active toward all the large neutral amino acids. Tryptophan is the least abundant amino acid in protein. There is competition between the various amino acids for the transport system. So after the ingestion of a meal containing protein, the rise in the plasma level of the other large neutral amino acids will prevent the rise in plasma tryptophan from increasing brain tryptophan. The idea common in popular culture that a high-protein food such as turkey will raise brain tryptophan and serotonin is unfortunately what? Unfortunately false. So there's a ditto effect as far as getting tyrosine into the brain. We need carbs to do it. And those given tyrosine have significantly reduced headaches, stress, fatigue, muscle aches, and sleepiness compared to controls. Improvements were noted in mood and mental states, happiness, mental clarity, hostility and tension, and cognitive tests, math skills, coding map compass, pattern recognition in the tyrosine group. So these are IQ-related things, but also happy and energy-related things. Tyrosine increased feelings of vigor and actually improved blood pressure. Now that's the opposite of your SNRIs. Your SNRIs, selective norepinephrine reuptake inhibitors, they all have black box warnings because they increase blood pressure and they can cause severe hypertension. But when we take care of the underlying problem, which is not enough tyrosine, the depression improves and the blood pressure goes towards normal and it drops. So that's when we know we're taking care of the underlying problems, when we only have positive effects and not side effects, where we're having to balance the effects and the side effects. Tyrosine has a different group of foods that are high in it. Notice the greens show up, mustard greens, lamb's quarters. Some people are confused about that. That is not the hind leg of a small sheep. That's actually a green. Tomatoes, lima beans, tofu, but higher than tofu is edamame. What's edamame? That's your green soybeans. Almonds show up on this list. Oats, sunflower seeds, wheat germ. This is why whole wheat is actually a healthy food. Our nation's gotten into the idea where they think whole wheat is bad for everybody. And it is not. It's bad for less than 4% of the population that are sensitive to it. And out of that 4%, very few of them have celiac disease, less than 25%. And a lot of those are not sensitive to wheat. They think they are. They're sensitive to the pesticides and the things that are raised in non-organic wheat. So if they changed over to organic wheat, often they're able to tolerate it. But there are two higher foods than wheat germ, and that is peanuts and pumpkin seeds. Tyrosine also has ratios that will help. The ones at the bottom of the list do best. And notice watermelon shows up. Watermelon is a food that if you're not on caffeine, it will stimulate you because you're going to make more dopamine and norepinephrine. That's why you want to have your watermelon more in the evening or at lunch, but not at nighttime if you're caffeine-free, because you won't want to go to bed. Mustard greens will also have a stimulating effect that way. So don't chow down on high-protein sources to boost either tyrosine or tryptophan. We want to have the lower protein diets along with the carbs that lead to more amino acids in the brain, and emphasize carbohydrate-rich plant sources of nutrition. So I think that concludes the sections I was wanting to talk about today. Maybe I can mention a summary slide at the end. This is an actual direct quote from a prestigious psychiatric journal. Now is the time for the recognition of the importance of nutrition and what else? Nutrient supplementation in what field? Psychiatry. Nutritional medicine should now be considered as a mainstream element of psychiatric practice. This is after reviewing a number of studies on nutrition in the brain, and the study's author states this: in times past, if you were talking about nutrition in psychiatry, that was called alternative medicine. In other words, the scientific medicine were the drugs, and the kind of quasi-science was the nutrition. But they now state that there's actually more solid scientific evidence for the use of nutrition and nutrients than there is pharmaceuticals. So in reality, pharmaceuticals should be considered the alternative, barely science type of approach. And nutrition and lifestyle approaches should be considered as the mainstream solid science, because there's so much evidence now for this as being a far better approach for mental illness and reversing things like depression and anxiety. So are there any questions about what I've presented. I mentioned last night we'll be glad to have the microphone rove around and ask and answer some questions if we can, and or we could have a microphone up here and they could all come up. I don't know how we'll do it. All right, the pastor will get some exercise and move the microphone around.
For the near infrared, can you get it from the sun, or do you have to buy that special box?
No, you can get it from the sun. By the
How
way,
much of the sun?
near infrared you get from the sun, but interestingly, you also get it from the reflection of the sun off of green plants. So when you're in a forest, you're also getting infrared. But when you're walking the streets of New York City, you don't get infrared because those buildings do not reflect it off, they don't bounce it off, they actually absorb, and the infrared's gone. So city living among buildings, you're not getting infrared, but among plants and outdoors, you're getting it. Now in the Canadian sense, and also up here, in the wintertime, there's not a lot of sun. And if you're working indoors, where a lot of people do have to work indoors, they might be accountants. You know, even in my GI world, I've wished for a long time that we could do colonoscopies outdoors, but we don't. I think the patient would benefit, and I think the doctor would benefit too from that sun. But nonetheless, you know, obviously it's not done that way for very obvious reasons. But nonetheless, a lot of cognitive work is done indoors, and so you may not have the opportunity to get outside much in the wintertime, and so that's when you'd want to get a box like an infrared box to be able to get that advantage. Yes, question back here, yes. All right, we'll go to the blue mic until we get the red one working.
A lot of information presented. What is the quickest way to kind of get a summary of what foods would be right to get the right mix of nutrients into the brain?
So yes, we gave you a kind of a 20-minute version of nutrition in the brain. There's obviously a lot more to that. But that summary page, the excess cholesterol, arachidonic acid, the way to get rid of those and also add antioxidants is plant-based. And so plants don't have any cholesterol, they don't have any arachidonic acid, and those are very beneficial, and they're high in antioxidants. And antioxidants have been shown to be antidepressant of themselves after 6 weeks of taking those antioxidants. By the way, when people go home, they've already started to respond nutrition-wise in 10 days in our 10-day program, but I have to remind them in the re-entry, it takes 6 weeks of this diet for you to get a very nice, significant effect. And some of those individuals will be missing their McDonald's hamburger and go to the Sacramento airport and say, McDonald's, wow, I haven't had a hamburger in 10 days. And they can actually get off of their diet immediately and never experience the full benefits of the biochemical advantages of the diet that we've been teaching them. And so we have to tell them that so they at least try it for 6 weeks. Then we repeat their lab work. In 6 weeks, we repeat their lab work, and we can see how things have corrected, and they can also see symptomatically how much better they're doing and cognitively and all of that. So if I were to summarize, it would be high antioxidant foods that are plant-based that also have adequate tryptophan, tyrosine, and some of these other nutrients. Yes?
Do you have any experience in successfully weaning off someone from Haldol?
Haldol. Yes. So one of the things that's increasing significantly, and you know, people have known that anxiety and depression is increasing significantly, but that is more considered due to lifestyle, diet, those sorts of things, where schizophrenia is thought to be, quotes, that real biochemical challenge, mental illness. And so that people think is staying stable, less than 1% of the population. That is not true. Schizophrenia is on the rise, and it's on the rise exponentially. And why is schizophrenia on the rise? Anyone want to guess what has been introduced in our society, particularly the last few years? Someone hit on it, marijuana. Marijuana-induced psychosis. It's a real thing. And by the way, if you are genetically set up for schizophrenia, which a lot of the population are, one marijuana usage will increase your risks 12-fold of having lifelong schizophrenia or paranoia. All these recreational marijuana joints that are showing up, they should not be allowed to dispense marijuana unless they have had a genetic test that comes back negative from those patients. And of course, it would cost them $1,000 to do that test, so they're not going to do it. Their profits would all go away. And so they administer to very innocent people that are just thinking they're wanting to try it or see if it'll help their anxiety, and produces an issue. By the way, marijuana is very much related to nihilism as well. Does anyone know what nihilism is? Nihilism is where you think it would be better off for everyone to be annihilated. And so the one thing that's on board of all these mass shooters, marijuana. They're all positive for marijuana and THC. And they're not all positive for alcohol. Alcohol can suppress your frontal lobe where you want to fight your relatives that you're upset at. But alcoholics or people under the influence of alcohol will only kill people that they know. They don't kill people that they don't know. Alcohol doesn't produce that nihilism. But marijuana will make you want to kill people you've never even met before and do this mass shooting thing. So, all this controversy in our country about should we allow guns, because if guns are legal, then we'll have mass shootings. But then there's people worried, well, if the illegal people will still have guns, but if safe people that carry guns don't have them, then the shootings could even get worse, et cetera. So you have this left versus right argument, and no one is actually getting to the root of the situation. Would be no guns sold to anyone who's positive for marijuana or who's going to be using marijuana. And if you use marijuana, it should be illegal for anyone, whether they're a policeman or whoever, to be utilizing a weapon like that causes nihilism. The weapon doesn't cause nihilism, but using a substance that causes nihilism, and now you give them a gun on top of that. And so I know that wouldn't be popular. About half of the voting base of one of the parties would never be able to buy a gun, and that wouldn't be good. But for their party, per se, they're thinking. But it would also affect the other voting base as well. Not all of the other people in the other voting base are marijuana-free either. But back to the question, Haldol. So we've had marijuana-induced psychosis patients, and they've been put on Haldol, and they come to our program. And can we get them off the Haldol? The answer is slowly we can if they don't go back to the marijuana agent. We did that recently with a young man about 4 years ago, schizophrenia induced to marijuana, from marijuana. We got him off his Haldol. We got him off his marijuana. We told him and educated him very well never to go back to marijuana. 3 years later, he was doing so good, he was in a group of friends, and he used marijuana again. And he went right back into the psych ward. Schizophrenic, manic, the whole bit, and he's still on Haldol. The second time, we couldn't get him off it. He hasn't come through our program the second time, but as an outpatient, he's not. Maybe we'd be able to get him off if he went through the program, I don't know. But can Haldol be weaned off? It depends on the cause of the schizophrenia, and of course, it could be maybe changed to another agent. So that's that answer. Yes, another question.
Yes. What about CBD? Is it, without the THC, people take it for pain? And what do you think about CBD?
Well, here's the issue with CBD. There's no such thing as pure CBD. If you're taking a CBD product and it says pure CBD, all the THC is out of it, you can take that product and I will measure your urine and it will light up with THC. They haven't been able to get all the THC out of these CBD products. If they could, that could be certainly more beneficial. There are certain seizures, for instance, that can be helped with CBD products without the THC, et cetera. There may be some beneficial properties with that. But most people are using things that have both. And the problem with the marijuana grown today, the marijuana grown today has 20 times the THC of what was being grown in the hippie generation. And so the hippie generation was a much more benign marijuana than what we have today. And people are utilizing it for the THC. Not that it was benign in the hippie generation. I come from that hippie generation, and fortunately I never used the product. But I know a lot of my friends did, and I noticed that their success level wasn't even a fourth of mine. It did cause some significant adverse effects even at that lower dose. Yes, another question.
Why do you only get vitamin D if the sun is making your shadow as long as you are shorter?
Yes, good question, and it has to do with ultraviolet. Ultraviolet light dissipates with more atmosphere that it goes through. And so you need that sun direct enough for us to be able to even receive the ultraviolet light. In the evening, when the sun is lower, it has to go through too much atmosphere, and the ultraviolet light it doesn't even come to our skin anymore. Infrared will, because it's a longer wavelength. So, for those of you that are into the radio waves that are the long waves, what are those called? Well, there's shortwave radio, but there's also long wave. It's the ham radios. Ham radios where you can hear people around the world, those are all long wave radios. And even in audio, if you're at a stop and someone has their windows up and they're playing rock and roll music, what are you hearing? You're hearing the low frequencies. Boom, boom, boom. But you're not hearing the high frequencies. The low frequencies penetrate. And infrared is low frequencies, ultraviolet's high frequencies, and so it dissipates and it can't make it to our skin unless it's directed. Yes?
I wonder if there is a danger if you live in a nearby marijuana plantation.
If there's a danger for what?
If somebody is living in a marijuana plant.
If you're living nearby a marijuana growing place.
Oh, yes. Can you smell THC? The answer is yes. And do you know what another word for marijuana is? Skunk weed. And it actually does smell very much like a skunk. When I moved to Northern California, there were some property owners that moved in next to us. And I thought, man, they must have brought a lot of skunks with them. I never smelled skunks till they got here. And I wasn't educated enough on marijuana to recognize they were growing a lot of marijuana. And in fact, the policeman came to our house and say, are you leasing space to these people? No, we're not leasing space. Did you know they're growing marijuana on your property? No, didn't know that. And fortunately in Placer County, you have to have a certificate of approval, and so they shut those guys down and the skunks went away. Yes.
Many doctors and pharmaceuticals, they're working together to keep a lot of the world unhealthy these days. Thank you for educating us on, just ways to improve our health. It's a real blessing to have you here today. Thank you. I had one question in regards to the fluoride in our water supply. I know there's the conspiratorial, and then there's just the U.S. government who's actually come up with numbers that basically tell a bad story of what it's doing to our populations. So what are the effects of what fluoride in our water supply is doing to America and the world, and what could we do to take some type of healthier approach to the fluoride levels? Is there something contrary to what the levels are that we could take to make us healthier and combat that? Thank you.
So yes, this underscores an area that we actually call an entire HIT category. For those of you that are more familiar with our research, we have shown that in order to have depression or anxiety, you have to have 4 different categories of HITs that are there. And one of those categories could be nutrition, another could be lifestyle, another could be genetics, another could be adverse childhood experiences. And so we have these 10 categories. And one of those categories are what we call the toxic hits. So mercury fits into that toxic hit aspect of things. Fluoride would fit into that toxic aspect of things. Arsenic, cadmium, these type of things that could be toxic. Even certain pesticides, DDD and DDT, and those sorts of things. And so we will look for toxicities, neurotoxicities that could actually have an effect. And one of those is fluoride, and it's been greatly underreported. Your dentists are involved in 2 of these toxicities, not so much the mercury anymore, because I don't think there's any mercury fillings being put in anymore. But when I went to the dentist as a kid, I would have a fluoride rinse. So after the dental hygienist did the cleaning of the teeth, it was thought that fluoride would actually be good for your teeth. And so you were actually told to mix this concentrated fluoride up and around your teeth and everything. And I don't know how much higher my IQ would be if that didn't happen. But nonetheless, it is something that can play a role. And of course, we want to be able to drink water that's fluoride free and that's either filtered. Now, not necessarily pure water is the best. It's good to have some magnesium with your water. It's good to have some other minerals with our water. But if it means drinking pure water and getting rid of all the minerals, the deionized filters work pretty well with charcoal, et cetera, to be able to get that fluoride out of there. If you're buying water, in the bottled water aspect of things, the type so far that's shown to not have those toxins consistently in it. Of course, I know it goes through a filtering system, and that's why it's probably best, but it's a little more expensive, and that's Aquafina. So if I'm out and about and needing water, I'll tend to get Aquafina to not get those toxins. But we do, once those toxins build up, it's a lot bigger question in regards to how to get them out. And of course, sometimes the damage is already done before we get them out. But yeah, good question. Any other questions?
I'm kind of curious about that nutritional medicine. Do you mean that we should try to get away from pharmaceuticals as much as possible and just go on completely on the natural foods and herbs? I don't quite understand.
Yes, well, thank you for the question. And if we can fix the underlying defect through nutrition, that's going to be better than taking pharmaceuticals. And that doesn't mean I'm against all pharmaceuticals. In fact, I was just having a conversation with someone before I came up here in regards to someone who the benefits certainly outweigh the risks in taking pharmaceuticals for a serious medical condition. And there are some people that have misinterpreted Ellen White as saying that she's against all pharmaceuticals or anything that the pharmacy would produce. But that is not true. There is a medical student that actually wrote her a letter saying, what do you mean when you're referring to drugs and poisonous drugs? If you read that letter and you read the letter that Ellen White wrote in return, it's very clear that she was for pharmaceuticals when the benefits outweighed the risks. She also criticized a person and a missionary family who was over in Africa who refused to take quinine when their kid had malaria. And the kid died. And a missionary died as well. Why did they refuse? Because quinine is a poisonous drug. I mean, it actually is poison if it's used in too much, etc. But that was an extreme view. And she says it was unnecessary deaths. And so we had to weigh the benefits versus the risk. And if you have malaria, you better take that when you're over there in Africa. And so we have to weigh benefits versus risk. But what I am really, and where I talk about it not being really scientific, is once we diagnose depression and anxiety and we immediately give them drugs, it's going to decrease their ability to even store these things long term. We're putting them on a slippery slope when we don't try to find out why they're not making those neurotransmitters to begin with. And if we find the reason why, it's often a simple supplement that they need to correct it all. And then they don't need to get into the side effects. The side effects of the SSRIs are apathy. It can cause an I don't care attitude. Some people like that if they have crying spells, because if you don't care, you don't cry anymore. But you also don't have the joys of life anymore, and you don't have the motivation. And the other thing is the increased suicidality that occurs from these drugs because they increase impulsivity. And so when you're increasing impulsivity, causing apathy, and giving that as the toolbox without looking for a nutritional reason why we could correct that, that's not good medicine. And that's something that we're trying to educate the rest of the physician society to practice better medicine where we do less harm.
Would it be possible for you to show that slide again where you talked about depression and anxiety on a split slide? You had the depression one up there for quite a while, but the anxiety one just briefly, and I didn't get a picture of it.
All right, let me see if I can go back and find that slide. Anyone else while I'm finding that slide? Yes.
I had a question right at the end of your talk. You said the time has come for two things, nutrition and the other one, is it?
Nutrient supplementation.
The two things?
Nutrition and nutrient supplementation. Yeah. All right, well, you've been a very attentive group. Okay, one more question. We'll do one more.
Thank you so much for coming. I also had a question. So if someone's not able to come to your program, what would you say the first step they would take?
Okay,
for
so
this?
Yeah, I've talked a lot about the residential program, but there are other options. We do have a community-based program, and I understand from your pastor that it's actually been run here in the Red Bluff Church. Are you guys aware of that? It was probably before COVID, but it's a good time to resurrect it. We've come out with a whole new program with new updated data, and that's something that's very inexpensive, and you have some trained coaches that can bring you through that. We also have an online one that's also very inexpensive as well that can teach you some of these principles and go from there. And so In fact, normally we recommend that you do those things first if you're able to. Our residential program is for those who are either not able to go through a community or online program or not able to incorporate that in their life. And they might learn about it, but they don't have the proper motivation or they don't have the wherewithal to be able to do these things. And so our residential program can guide them through that process. Or if they have a resistant form of depression where they've tried some of the lifestyle things, but it doesn't seem to be working. A lot of times people think, well, then the residential program won't work. And not true. Our studies show if you go through the online or the community program first, and you still need the residential program, you will actually do better than people who haven't had the online or community program because you're already ahead of the game somewhat. And so you'll have a very good response rate for the residential program. We also have some books on it. In fact, I hesitate to do this because I only brought 7 of them. The latest book that's published out there is written by John Bradshaw and Neil Nedley on depression and anxiety. And I brought 7 free books out there. And even reading that and incorporating that could be helpful. We have some other brochures out there as well. Well, thank you very much. God bless you.
Thank you so much, Dr. Nedley, for coming. Actually, I'm going to just have you stand right next to me. We really do appreciate you sacrificing your time and your weekend to be here with us, to bless us with the wealth of knowledge. I'm just going to invite my elders to come up. We're just going to have a special prayer of dedication.
Oh, thank you.
That God will continue to guide and bless your ministry and your family. We'll just lay hands on him and we'll pray, and this will also be our prayer of dismissal. Gracious Heavenly Father, what a privilege it is to come together as brothers and sisters to equip ourselves with knowledge from your throne, from nature and the things that you have gifted Dr. Nedley. Lord, we thank you for how wonderful and how fearfully our bodies are and how resilient they are. And yet, Lord, you have given us these natural laws of health. You've given us remedies. You've given us even scientific knowledge to allow our bodies to be restored according to your plans. And ultimately, Lord, you have shared these things through your manservant. We just pray that you will continue to equip him with wisdom, that you will continue to use Dr. Nedley in all of his other endeavors. May you bless his marriage, him and Erica, and their 4 sons and their families. Lord, that your light and your Holy Spirit will continue to shine in and through each of them. Then, Lord, whether we meet again on this side of heaven or around your throne, please keep us faithful. Keep our eyes focused on you, and may we continue to share your good news and your gospel message to a dying world. We thank you and praise you in Jesus' name. Amen.
Amen.
Thank you so much to each of you also for coming this weekend. Hopefully you were blessed. We will have the video recordings. There's online on YouTube for the next 3 months, and then we will be taking them down. So please, if you know someone that would benefit and you would benefit to rehear it, please go ahead and go to our YouTube page or Vimeo page and for the next 3 months, and then we will be taking them down. God bless. Have a wonderful Sabbath.